Thanks, KG. That's very kind of you. Um, I'm in sort of an indecisive mood kind of a day today, so I couldn't figure out whether to present slides or not. And so I'm going to do something which I've never done before, which is actually have slides in front of me and not in front of you. So, or at least thoughts here. It's mostly because, the topic that KG wanted to speak about was really on the impact of AMR in sort of the non-health space, and then to actually make the investment case. Let me say at the outset, much of the impact of AMR, in fact, nearly everything that we understand is in the health sector. The causes may emerge from outside of the health sector, but all the consequences are really in the health sector as far as we know. But the ones that are outside are potentially large, which is what I really want to talk about. But before I want to do that, I just want to sort of step back, and this is one of the reasons I was not sure about presenting slides, which is I think we tend to think of AMR much like we think of other diseases like TB or malaria or whatever it is. It is not. It's something that's so fundamentally different in terms of it underlies all infectious diseases, which are not entirely vaccine preventable. It underlies not just infectious diseases, but also chronic diseases because our ability to deal with surgeries, go through cancer chemotherapy, have a hip replacement, any of the things that we consider modern medicine depend on having effective antibiotics. Our experience with antibiotics is incredibly short, really in active use only since the mid-1940s, 1950s. And in fact, our experience with resistance is even lower. We've always sort of warned about resistance going back a long time, but the actual uptick in resistance that has everyone running scared now is only post-2000. Until then, resistance was typically under 1%. It then shot up to being about 40 or 50%, which wasn't a surprise because the bugs were figuring out how to get from 1 in 10 million to 1 in 100 over a 40-year period. And then from there, they went from 1 in 100 to 1 in 2, which is a relatively, short hop, skip, and jump for them. And now we're faced with this problem, and then we're thinking about how we're really going to solve this problem. So, and the other part of AMR is that it's different in that you think of it as we have a portfolio right now of antibiotics with a certain effectiveness. That's what we have right now. What is important is also the journey to get to this average level of effectiveness. What I mean by that is if we just wasted all our antibiotics, didn't give it to anyone, didn't save any lives, and we got to the same level of resistance, is that different from having used it effectively to save people's lives and get to this average level of resistance? So as focused as we are on antibiotic resistance today and the costs of that, I think what we really need to pay attention to is what did we really achieve in the process of getting here? Just like saying, we depleted oil to a certain point and we're here and that's the cost of oil today. But what really matters is that we built entire economies and roads and everything else on the back of that oil. And that's the way in which to really think about AMR. I think the sort of full frontal approach of just dealing with it as a disease, it's great. We can have discussions around that. But then it sort of misses the point of what we want to do going forward as well. What we want to do going forward as well is to really focus on getting the best value out of antibiotics in the best way that we can. And it also involves investing in replenishment of that stock of effectiveness, which could be through new antibiotics. It could be about conserving that stock of antibiotics, which could be through, through hand hygiene, vaccination, some of these that you saw out here, in which case we're using antibiotics for what they are truly good at, which is saving someone's life when they're actually going to be dying. So in that world, we might deprioritize, treating acne, which is really the biggest reason why antibiotics get used, or, using antibiotics for, as Dean had last week, for prophylaxis after a dental procedure, for 10 days, even though there's literally no published study which actually supports that. This just goes back to the history of how antibiotics were first introduced. And I think it requires a much more fundamental rethink of what antibiotics do to our health systems and of our agricultural production systems than just to try to project what we do as a cost. I mean, don't get me wrong. I love the work that OECD and the bank are doing because it's important to drive the conversation. But this is a much more fundamental rethink about what antibiotics mean to our health system, which is much more fundamental as a tool than literally any other tool that we can really think of. And I don't think we've wrapped our minds around exactly how to do that. Now, the consequences for human health, are pretty direct. There's newborns that are dying of sepsis that are preventable, but are, the deaths are caused by drug-resistant pathogens, over 200,000 that we estimate. Similarly, in the case of this underlying surgeries, there's lots of people who are dying because the antibiotics are probably less effective. But again, what we're missing here is the point I was trying to make this morning, which is, what if grandma chooses to not get that hip replacement because she now perceives a higher risk of infection post her surgery, and therefore decides to live with a bad hip for another 5 more years, or perhaps never gets a hip replacement? Those consequences are much larger than even if she were to get that infection at all, because there's lots of grandmas and lots of hip replacements, and nearly everyone will have a hip replacement. So those behavioral adaptations to not having effective antibiotics, or having antibiotics being out of reach because they're unaffordable, are likely to be, quite significant. So I think that's what we really need to think about in the health sector when we think about, the benefit of interventions. Couple of other points. One is the animal sector. Now, this, whether we like it or not, is where most of the antibiotics go. China consumes more than half the world's antibiotics. 80% of those antibiotics go into animals. In fact, probably more in China, and 80% of the world's antibiotics go into animals. And what that is really doing is something positive, because it is fueling this revolution in upscaling animal protein consumption, which is probably one of the defining sort of environmental changes of our lifetime, that the average person in China today eats 6 times the amount of pork that they did 25 years ago, or that the average person in India will eat 5 times the amount of chicken per capita in just 20 years than they do today. These are enormous changes. And I think when you really think of the environmental consequences, it's not just on the health space. It is that antibiotics as an input into protein production have made meat so cheap, which is good on the one hand, but then has this vast environmental consequence on air, water, runoff, certainly climate as well. You don't think of antibiotics having a climate impact. This is one way in which they do, because they're an input into this production process, of which the result is really to do with climate. And we know that about 1/5 of the world's emissions really come from agriculture. Right? That's where much of the, as a single category, it's a pretty significant category here. So I think in those ways, thinking about environmental impacts are well beyond what we have traditionally thought about to do with antibiotics, because again, they're much more profound in our systems than we really think of. And then there's also the impact of having them in the environment. There was a recent study which showed that the NDM1 gene was found to be over 20 times greater in the Ganges during the pilgrimage season than at any time of the year. When there's mass bathing, there's 10 million people in the water all at the same time. Guess what? Some of them are not playing fair. So, and there's a huge increase in NDM. And those are consequences that we don't generally think about when we think about antibiotics. We tend to think of healthcare institutions and so forth. And beyond that, there are broader changes that are poorly understood because we don't understand the microbial world at all. I mean, this forum is on microbial threats, but we generally tend to think about that as infectious diseases affecting humans. But microbes are essential to human life, largest biomass in the world, provide half the world's oxygen, they're important for rainfall, for the nutrient cycle, all of which poorly understood in terms of what dumping 200,000 tons of antibiotics into very concentrated ecosystems, typically rivers of countries. The Chinese rivers have 10,000 times the concentration of antibiotic resistance genes as you would have, in just typical, groundwater anywhere else. We just don't understand what the broader consequences of this might be. And when you consider the fact that, we may be killing off oxygen-producing microbes, we won't know this for a long time, of methane-eating bacteria, and certainly of human gut beneficial microbes, we don't understand these environmental consequences at all, because we've been doing this natural experiment on the planet in a relatively short period of time, and then we may figure this out as we sort of go along. So just to conclude, let me say that I think there's a lot that we really need to understand here, but for the current time, the benefits of investing in antibiotics are all going to be within the health sector. The outside of the health sector is going to be something that we have to figure out a lot more. Now, 4 years ago, the US had a budget in aggregate for AMR, probably less than $3 million. I was at CDC yesterday, and they reminded me that one of their first stewardship meetings was something that we paid for from a grant from the Robert Wood Johnson Foundation. Today, CDC has probably $180 million. Today, the world spends about close to about $2 billion, all the funders put together. But guess what? most of that money, probably about 2/3, goes into new drugs. Small part of that into new diagnostics and vaccines. Very little that goes into conservation. And if we have to really think about where we prioritize money, because that's the purpose of this whole economic exercise, I think we really need to think about where we're going to be able to maintain this ability to use antibiotics in the most appropriate way possible, and therefore get the most value when arriving at a different portfolio level of resistance, rather than just saying, I just want new antibiotics because I ran out of the ones that I have. That's not a satisfactory answer, and if we do that, we'll be repeating a lot of the mistakes that we've made over the last 50 years. Thanks, Keith.